My name is Jacqueline Holloway, and I will be presenting a policy analysis on the Mental Health in Schools Act of 2017. The Act will address violence in schools and children's mental health. It was actually proposed as a result of gun violence perpetrated by youth in schools across the U.S. Now, even though school violence is perpetrated every day, from fights, threats, bullying, and gun violence, it's just become more publicized since mass shootings like the tragedy at Sandy Hook Elementary School in Connecticut. And also, research indicates the majority of school shooters have engaged in behavior that should have been a red flag. And then also, most shooters have attempted or considered suicide, while mental illness and social isolation are two main factors youth perpetrate violence. And so the program will provide access to comprehensive school-based mental health care, which is culturally and linguistically appropriate, trauma-informed, and age-appropriate, that will build awareness of trauma and mental health for youth, and then also provide training for school staff, not just the teachers, but also administrators, any auxiliary staff, to include maybe food service, even maybe say bus drivers or custodial, anybody that maybe comes into contact with these students. They should be able to identify some sort of red flag and report that. And then also the family members of these children will get some of that training as well, and concerned community members who are looking to support those students as well in their communities. And then the partnerships will be between schools and communities, community local practitioners, and community agencies, whether it's welfare agencies, local law enforcement agencies, mental health and substance abuse service systems, and so on. And then lastly, it will establish mechanisms for children to report incidents of violence or plans by other children or adults to commit violence. The Act will be administered by the Secretary of Health and Human Services, who will work in collaboration with the Secretary of Education, and they will both work in consultation with the Attorney General. The grant amount will be $2 million, and there is an application required with assurances. And it also notes in the text of the Act that there's an authorization of appropriations, which $200 million is authorized to be appropriated the same years of 2018 to 2022. And the eligibility requirements are around the partnerships, which they must include a state educational agency and one or more local agencies, educational agencies that is, and the local educational agency will serve as the leading partner. And then they must submit an application that is endorsed by all members of the partnership, and they will enter a memorandum of understanding with at least one public or private mental health entity, whether it's healthcare entity, law enforcement, or juvenile justice, or child welfare agency, family-based mental health, trauma network, things like that. And then the assurances in the application, it should clearly state the intentions, for example, responsibilities of each partner with respect to the activities to be carried out, how family engagement will be incorporated in the activities, and so on. And as far as limitations go, the only one it was surrounding how the funds will be used for evaluation purposes of the effectiveness of the program. No more than 10% is to be used for that. Once enacted, the policy won't actually solve the problem of violence in schools or cure mental illness. However, it has many strengths that will help to reduce that violence and address mental illness in schools. So it supports early detection of mental illness, which is pertinent for youth, as most people who do develop mental health disorders, they may experience signs and symptoms by age 14. So that should definitely help get some treatment early on, which could potentially lessen the acts of violence or falling into homelessness, substance use, or being incarcerated later in life. And then also it's consistent with the values of social work practice. For example, service, it is addressing that social problem of mental illness, dignity, and worth of the person. It's providing resources within schools that will promote self-determination, giving youth the capacity and opportunity to get their mental health needs met. And then it also, a big one is recognizing the importance of human relationships. Basically, this policy will pull together communities. It makes me think about it takes a village to raise a child. So consider that you're pulling the teachers, principals, all those educators, anybody working within the school district. Then you have the families, other students, community members, and local practitioners, pulling everybody together to support the mental wellness of youth and their overall well-being and the community as a whole. And furthermore, it's consistent with the recovery-oriented social work practice, as it supports the allocation of funds to put mental health resources in schools and communities that have little to no access. And it also lessens the cost for families who typically don't seek out those services because of the cost. And so that whole accessibility thing for those reasons. And then promotes greater social equality, as all the programs will provide education and training to mental health educators, volunteers, families, community members in an attempt to help promote an overall mental health awareness, which will reduce stigma in those communities, the negative stigma associated with mental illness, such as violence. And as for the weaknesses, all of those will fall under unintended consequences, and that would especially affect the youth who are actually taking part in these programs that will be put in these schools. So you're looking at self-stigmatization, devaluation, and discrimination against those students. And one study indicated that their concerns would be their friends' negative reactions, maybe gossip and pity amongst other students, and fear of being shunned or ignored after disclosing that private information. They don't want to be looked at differently, which in some cases it could go either way with adolescents. Either they understand it and they treat them with that dignity and respect, or you may end up getting some bullying behind that. Okay, so here we are at opposing viewpoints. So these groups basically share the same view that the act is unwarranted government intervention. So you have parents who indicate their children have been misdiagnosed and forced to take medication, whereas the Citizens Commission on Human Rights, AbleChild.org, and Ed Action, they all want to prohibit mental health services by schools. These groups argue it's the job of the parents to ensure the child's well-being and find the practices to be invasive of family life. And they are actually pushing Congress to pass legislation that prohibits federal funding for mental health screening without parental consent. So, as previously mentioned, violence in schools has always been around. However, it is more publicized. And since the Sandy Hook shooting, several states have upped their gun control laws. And these groups listed here, out of them, Connecticut passed one of the strictest gun laws in the nation. The law expanded a ban on selling assault weapons, banned the sale of magazines that hold more than 10 rounds, and required owners of both to register with the state. The bill also allocated $15 million for expanded school safety and mental health programs, and includes new eligibility requirements for ammunition sales. And it also has a provision to create the nation's first registry of dangerous offenders, which will be accessible only to law enforcement officers. Furthermore, New York passed a law that created a state database for pistol permits, reduced the maximum number of rounds legally allowed in magazines, and required universal background checks on all gun sales. Maryland banned the purchase of 45 types of assault weapons and limited the number of rounds allowed in magazines. Florida passed legislation to allow law enforcement to petition courts to temporarily remove guns from someone who displays warning signs of violent behavior, raises the age to buy guns, and prohibits bump stocks and ensures background checks are passed before guns can be transferred through licensed gun dealers. And also, there are schools in Florida getting millions of dollars to spend on mental health counselors and services for students this year as a result of the 2018 school shooting just in February that left 17 people dead. As for political suppositions, this policy is thought to be liberal, as it supports the government being active in implementation of this policy, whereas the opposing its unwarranted government intervention. However, because this problem has become so prevalent, it's time for the government to be involved. And their role would be to work in partnership with state agencies to address mental health, to include providing funding, regulation, protection of consumer rights, and just overall continued support for backing mental health in schools. And the act is also going to help to reshape how society views and responds to mental illness, and by increasing the quality of life for students and their families. And the program carried out would indicate its affecting. So in summary, the Mental Health in Schools Act of 2017 will provide a first step in early detection and intervention of mental illness in youth, as well as create widespread awareness of the importance of receiving mental health care. The program supports prevention measures to lessen the possibilities of youth growing up to face further social problems and potential for acts of violence, whether it's at home, school, or elsewhere within their communities. With these points in mind, it's evident that the necessary steps should be taken to pass the act to provide support and access to mental health resources to protect the future of children and society as a whole.